So today we will be uh, talking on a topic called scope of preconception. See, preconception is like one of the what do you say in demand subject in our practice, where we see so many couples going to so many infertility centers where they are like going with IUI, IVF, failed IVF, then people who are so frustrated with their day to day struggle to get conceived. And when we see such patients coming to our OPD and they don't know, or few of them who want Shreyasi Praja, that is the one with all the good qualities, and who wish to have Swa Ichchita babies. For them, this preconception care is very important, and it is having lots of scope in our practice. Okay. On that thing, let us start with the topic. So, the topic is scope of preconception care. Reproduction is the nature of living organism to produce identical offspring or progeny. In our classics, we see that a woman or a couple is given respect when only they have a child. This is told in our classics. And a woman or a husband or the man can do a yajna only when they have a progeny. So much of importance has been given for having a progeny in since so many Vedas or Upanishads or in our Ayurveda. When we see, there is so much of importance to have a praja, or we say a progeny. Ensures to improve the health of woman and newborn. If we um, explain the patients who come to us, like sometimes what will happen, few of them will be like just coming for um, what do you say, refreshing or rejuvenation therapies, like wellness therapies. During that time also we can educate them like how important preconception is, why we have to go for a preconception, why it is important to detoxify your body to have a good progeny for the bija shuddhi. What is the importance of the bija shuddhi? Main thing is like for the health of the woman and newborn, so that there is no complication during her throughout pregnancy, and also the baby which is being born should have all the good qualities. Okay. Stresses on risk assessment, health promotion, and education in preparation for the childbearing. Here in the preconception, we are assessing the risk. For example, we have to think about the DIC. That is, if she lands up into the complications during her third trimester, or if there would be some chances of she getting diabetes. For example, her parents are diabetic and she may land up into gestational diabetes. Then we have to counsel that patient that if you properly go with the cleansing of your body and maintaining the ahara and vihara for not to have any diabetes, then we can educate them. Or they are having any history of genetic uh, issues, like in their familial history there is some history of neural defects, or there are any syndrome, or these all risks which are there, we have to assess before pregnancy and we can educate for them. If it is a consanguineous marriage, like there is a consanguinity between the husband and wife, then we have to educate them what are the risks of getting genetic disorders and how we can prevent and what you should follow for that. Then health promotion, to have a healthy life and healthy way of living so as to have a healthy
Right,
baby.
online.
And then education in preparation for childbearing. Most of the primary women or the primary para, like when they are going through the process of pregnancy, in the third trimester they'll get so anxious to deliver. They will be so scared, you, what will happen, how will I deliver, what would be my uh, fear, like of how the baby will come out. For that also we are going to educate throughout the process, and we will be educating this the whole process even prior to conception also. So emphasizes on identifying and modifying medical, behavioral, and social risk factors before pregnancy. See, for example, she is a girl who smokes, who drinks, who parties, who is a pub girl, or they are like of a high society, where there is so much of product drugs or whatever we tell which are addicting, then we have to educate them what are the complications if you follow, and what would be the better way if you quit it now only and then have a conception. And also behavioral and medical. For example, behavioral also would be like if mentally she is so stressed out, so much of day to day activities are so stressful in nowadays. Everybody is stressed, like no, there is no person on this planet there is no stress. But if we try to inculcate some day-to-day activities, like we will educate them for going mindfulness, or we will tell them to go for pranayama or a regular walk. With a regular walk, it would be a couple walk, like both of them togetherly go for a walk, have a talk. There is no time to talk. Main thing, main complaint we get into infertility: husband has no time, woman has no time, everybody is busy in their phone. So educating them how important it is to be connected to each other, how behavioral changes you have to do, and how socially you should also be connected. For example, one person is interested to go to temple, the other person is not at all interested. They're like, where is God, what is God? Atheist. Then we have to educate how it is important that you should believe in our culture and follow the traditions what are there. That also is a part of preconception. So this is regarding a small intro about why preconception is important. Even though preconception care is described as the new concept in modern obstetrics, now it is like they are also believing in it and they are practicing preconception. They are having a unit for it. And Ayurveda explains the Garbhadana Vidhi long before. We have seen Garbhadana Vidhi since so many uh, era. It is like era antanaku Vedas. From that time, we are seeing Garbhadana Vidhi. Ayurveda emphasizes regimen and procedure for proper conception, that is the Garbhadana Vidhi, and its importance for having the Shresi Praja. Ayurveda explains the concept of reproduction from mere biological process to socio spiritual benefits by explaining the role of Manasika and Adhyatmika Bhava in the formation of Garbha. This is what we give in explanation regarding the social behavior and social connectivity of being there, and also the stress factor which has to be maintained in the formation of garbha, because samanasya garbhadharanam. Okay, the garbhadhana vidhi or a preconception basically compromises of what: bija shuddhi, kshetra shuddhi, mana shuddhi. Bija Shuddhi is the quality of the sperm and ovum. Kshetra Shuddhi is the endometrial bed. See, sometimes what will happen, we get even in our, when we have a collab, like we are having a collab to infertility units of like IVF or super specialty infertility units. Then what will happen? Sometimes they are failing to do the endometrial thickening of the endometrial bed basically. In those conditions also we can help them out. For example, see, both the tubes have been excised, or they have been because of some tubal pregnancy, that is ectopic ho gaya hai. So it has been excised and there is no any what do you say, tubes are not patent. Then we can at least help them out. See, these women in whom the ovum has been retrieved and it has been stored during the excision of the tubes, then we can at least help them for a proper bedding. These patients come to us that implantation is not happening because the endometrial thickness is not there. In those cases also we can help them. Kshetra Shuddhi we can do and try to line the endometrium. Then Manoshuddhi, to develop the pure consciousness because of the Samanasya Garbhadharanam. And also, if remember, if the Manas is in stability, if the woman is having a proper Manas, then the baby will also, the born baby, or during the conception where we tell in the Garbhava Kranti, where Mana is also important part of it. There, the sthiti of the Manas of the woman and the man will also affect the bijam. And when the mana is getting uh, avakrantam along with the bija shukra shonita samyoga is happening and atma is coming and mana is also important part of it. If the saumanasyam is there or the manasthiti is stable, then the satvika guna of the manas is enhanced, and that will also affect in the stability of the baby's brain development and the consciousness of that baby, along with the ahara, achara, and vihara. This is how the Garbhini Paricharya we will be explaining, that counts into the Garbhadana Vidhi along with all the Bija Shuddhi, Kshetra Shuddhi, and Mana Shuddhi. When we consider the explanation or the concept of Garbhadana Vidhi, first they explain regarding the Vivaha Yogya Ayuhu. Panchavimshati Tato Varsha Puman Naritu Shodashe. So, according to Acharya Sushruta, he is telling Panchavimshati for Puman, that is Purusha, and Shodasha for Stri. At this time, what will happen? Samatvagata Viro Tau Janiyat Kushalo Bishak. So, what they are telling is at this age, the Virya is properly formed. So, it is the better time for them to get married. At least minimum they should be of 25 years male and 16 years according to Acharya Sushruta. Then at this age there will be Samana Paripurna Virya in both the, so which conception takes place. Viryavanta Putra will happen according to Ashtanga Sangrahakara. Then coming to Samyoga Ayogya Striva Parinam. What will happen? Samyoga Ayogya, the woman who is not fit to go for conception, in whom conception should not be taken place. That is Atiyashita, Kshudita, Pipasita, Bhita, Vimana, Shokartha, Atibala, Ativruddha, Dirgharoginam, and Tulya Gotra. So that is why whenever a marriage takes place, Sagotra marriage will never be done. Sagotra we should not do. Then Ati Ashita, who eats more. Kshudita, who is thirsty. Pipasita. Then Bhita, who is fear, having always Bhita. Something is happening, something will happen. That kind of Bhita is there. Vimana, very cruel. Then Kshokartha, always in pain, crying. Atibala, very small. Ativruddha, very old. Or Dirgharogini, she's having chronic diseases. In such Stri, there should not be a Sanyoga. Why? What will happen? Vigunam Praja Janeti. So the baby which is born is having Vigunam. Some or the other deformities will be there. Alpayu. It may die soon because of some sufferings. As there is genetic disorders which may come because of the Dirgha Rogini of the Stri. Then Alpa Bala Arogyam, less immunity. Vikalendriya, that is teratogenical, or we can tell physically some abnormalities. Then Garbha Kukshistha Vinashan Apnuyat, that is missed abortion, IODs, or the baby will die inside, missed, like there is a blighted womb, or there is no cardiac activity. That is called missed abortion, and IOD, intrauterine death, may happen. Okay. So these are the complications if there is a samyoga in the Stri with these lakshanas. Then comes the Garbha Samagri. Everyone knows this, right? Dhruvam Chaturunam Sanidhyat Garbhasyat Vidhi Purvakam Rutukshetrambo Bijanam Samagryat Ankuro Yataha. So which are the four? Ritu, Kshetra, Ambu and Bija. These are the main four samagris required for a proper Garbha to form. So Ritu Kala or ovulation period is considered as Ritu. Kshetra is the Garbhashaya, to be precise, the fallopian tubes, because the fertilization takes place. Ambu is Punarahara Pakajo Yapi Rasadhatuhu, that is nutrition. The Ahara Rasataha, what will be there, which nourishes the Garbha, which forms until the placenta is formed, that is the Ambuhu. And the Bijam is the Stri and Pumsa, Shukraha. Ashtanga Hridayakara adds another three factors, that is Marga, Rut and Vataha. Marga is what? Healthy genital tract. If there is no proper healthy genital tract, then where would the sperm ascend up, or where would the implantation take place? So the Marga is one of the important factor. Rut is Saumanasya Garbhadharanam, is how we know. So psychological status of the men and women both are important to have a proper Garbha. Vata and necessary in formation of the Garbha and also the development of Vata. What will happen if the Vata is not in the normalcy? There would be like, we see what Vata does basically. It is known for its dividing capacity. It may make it a twin pregnancy, or there may be triplets, or if it is not in proper stability, then it will cause vigunata, and it will cause what to say, deformities, like any vikalangas may happen if the vata is not in its normal state, or to form garbha only. If vata is not in its proper state, then there may not be any garbha formation also, because of the vimarga gamana. It may throw the concept as whatever has been formed inside, there would be repeated abortions. So that is also an important factor to keep in stability. That should be in its Samyavastha. And Acharya Kashyapa adds Ritu and Bija, important for the pregnancy. The Garbha is formed from the combination of Shad Bhavas also. The Shad Bhavas are also very important. That is Matruta, Pitruta, Atmata, Satmita, Rasata, Satvata, Ityebhyo Bhavyebhyo, Samuditebhya, Garbha Sambhavanti. So all these Shad Bhavas, mother, father, Atmata, all the bhava of these factors are important to form a proper Garbha. That is what even Acharya Charaka in Sharirasthana tells that again. सर्वेभ्यो एभ्यो भावेभ्यो समुदितेभ्यो गर्भो अभिनिवर्तते. Only when all the bhavas are in its samyavastha, a proper garbha will grow. Then understanding regarding the four garbha samagaris, coming to Rutu or Rutukalaha, Rutuscha Nishiktasya Bijasya Phala Prasava Anuguna Kalaha. That is the time suitable for bearing the garbha or the fruit. That is the main garbha is called Rutukalaha. It is considered for 12 or 16 days of the mass with the masa of Chandra Masa. That is in 28 days, 12 or 16 days of total it is considered as Rutkala. So Shuddha Yoni Garbhashya Artava Masam Api Kechin Tadrushta Artavo Api Pare. Andre at the 12th day, at that time, ovulation period is considered to be the Rutukala total. Then Rutu Paricharya for the proper formation of the Artava has to be explained to the woman that how she has to follow the Rajasvala Charya. Then after Rajasvala Charya, she has to have bath, then see her husband, take darshana of her husband, then follow all the vidhi that we will be explaining in the next slides. Then coming to kshetra or garbhashaya, Sukrushta kshetra bijam prakshiptam tatra vrihita kalpate. That is what it is telling, that the seed of the paddy sown in well prepared fields results into good yields. Similarly, the unvitiated bija when embedded in unvitiated kshetra forms the healthy bija. Haudala. That is when a proper kshetra is there. Then when unvitiated bija, if a good quality bija, that is shukra, gets embedded, gets fertilized and implants into a unvitiated kshetra, then a healthy garbha is formed as like the seed of the paddy. Then Stri with apradishta garbhashaya and Shuddha Srotas produces Ishtarupaha Medhavi Putram. So Acharya again explains that Stri with apradishta garbhashaya and Shuddha Srotas is important for having a Medhavi Putram. Who has kept the mic on? Kindly mute it. Garbhashaya vitiated with Tridosha produces Yoni Vyapat and is not suitable for the formation of healthy Garbha. So Garbhashaya has to be Shuddha so that there won't be any dosha vitiation taking place. Then Ambu and Bijaha. Ambu is Punarahara Pakajo Vyapi Rasadhatuhu. Stri Pumsayor Avyapanna Shukra Shonitam. So Bija is which one? The Shukra or the Shonita, that is the Bija without any uh, problem. That is, it is Shuddha. There is no any deformity. For example, if the Shukra semen analysis we do, there is some problem in that, then again we have to give treatment. If there is a if there is a bijam of a female ovum and there is any abnormality, like PCOD is there, ovulation is not taking place, very giant ovum is there, very small ovum is there, then we have to again give treatment for that. So our concentration is that we should have a proper Stri and Pumsa Shukram. And Ambu is Ahara Pakaja. Whatever the Ahara she intakes, the rasa which is forming. So we tell during the trying to have a baby during the Ritu Kala, not to eat very spicy food. There is a Ahara Vidhi which is told for the woman and the man to intake for having a Shresi Praja. Shukra Shonita should be in the Prakrita Avastha for proper conception, dushti of which leads to arthava and shukra dushtihi. And ahara rasa is important because it nourishes the bija, garbhashaya and garbha and responsible for the healthy bija formation. Rasa is the first dhatu. Uttaraha shukra dhatu will get nourished. And also the garbhashaya and garbha because arthava is the upadhatu there. Then the woman should also follow the ahara and vihara for maintaining the normalcy of the tridosha before indulging in maithuna. That is where we tell during the Ritukala what they have told. Stri should take taila and masha for Vata to be in normalcy, and Purusha should take Gruta and Kshiram. The asana for Maithuna also plays important role in the Tridosha stability and for proper Garbhadana. So Maithuna should not be done with the woman in her flexed position or Nubja position or in lateral position. In flexed position, Vayu gets aggravated and compresses the yoni, so it should not be done. In right lateral position, if they conceives, the kapha gets displaced and the obstruction of the garbhashaya takes place. So right lateral position is also not advisable. Left lateral also it is not advised because it displaces the pitta and burns the shukra and shonitaha. Hence, for proper conception, what should be done? Woman should lie in supine position so that all the dosha remain in their normalcy. So, which is the best one? That is in the supine position. Then, manasika avastha prabhava on the garbha. Here, Saumanasya Garbhadharanam is told by Acharya Charakaha, and Garbhotpatto tu manaha striya yam jantuhu rujet tat sadrusham prasute. So, whenever the manas is in a good state, then the baby or the fetus, whatever is being produced, will have the same Satvika Manaha. And Acharya Sushruta is telling the Ahara, Achar, and Cheshta followed by the couple during the course of conception, the baby will have the similar characters. So, what we are telling, we should have all Satvika Ahara Vihara so as to have the baby Satvika Gunaha. Okay. The woman who desires of a child with specific characters should always think of those characters. For example, if she wants to have some मोदी चाहिए, तो मोदी के बारे में सोचना है. ऐसा नहीं है. Characters basically, we have to think about the characters. What characters? Shauryavantam, Viryavantam, Balavantam, Ayushyam, Prabhavantam. जो गुण है, that गुण के बारे में उनको सोचना है. ओके, इफ फॉर एग्जाम्पल किसी को कृष्ण चाहिए, तो कृष्ण के जैसे गुण वाले, तो उनका गुण क्या है, उनके गुणों के बारे में सोचना है. Okay, the main thing is to think about the qualities, what characters or qualities the woman wants in her child, and follow the mode of life and behavior, proper code of conduct, that is which is told as an dinacharya जो बताया है, ऋतुचर्या जो बताया है, that has to be sadvrutta जो बताया है, that we have to explain them and ask them to follow that and have the diet, that is गर्भिणी परिचर्या में जो आहार विहार बताया है. और प्रायर टू द गर्भ, the main tailamasha or ghrutakshīram and having saumya ahara has to be explained for having the proper good characters in the fetus. In now explaining in detail regarding what is the sanyoga vidhi, what has to be done for having a proper shresi putram. ठीक है, तो पुरुषम और स्त्री, what they have to do. Purusha has told to follow masam brahmacharihi. Both male and female do is the same. Like both of them have to follow masam brahmacharihi. That is, they should stay away from each other for 1 month. Sneha swedanam, snehanam swedanam. उसके बाद वमन विरेचनाभ्याम संशोधये क्रमेण प्रकृतिम आपदये. तो दोनों को क्या करना है, शुद्धि करना है. वी हैव टू आस्क देम टू अंडरगो डिटॉक्सिफिकेशन. Commonly, if there is more, depending upon the dosha, which dosha is predominant in them, we have to plan the shodhana. Then samshuddhau cha आस्थापनन अनुवासनम भ्याम उपाचरेत. फिर उसके बाद में क्या करना है, बस्ती का कोर्स करना है, वमन करना है, विरेचन करना है, देखना है जो दोष ज्यादा है उसको ध्यान में रखते हुए आपको एक शोधन को प्लान करना है और उनको वो शोधन करवाना है. उसके बाद समशुद्धौ च आस्थापनम अनुवासनाभ्याम उपाचरेत. तो फिर उसके बाद में हम क्या करते हैं, आस्थापन बस्ती, दैट इज निरोह एंड अनुवासना हैज टू बी प्लान्ड. कहीं बार हम उत्तरवस्थी भी प्लान करते हैं, है ना. तो निरूह देने के बाद उत्तरवस्थी भी देते हैं. देन व्हाट वी हैव टू डू, मधुर औषध संस्कृताभ्याम घृतक क्षीर. पुरुष को क्या देना है, मधुर औषध संस्कृत करके घृतक क्षीर को देना है. फीमेल को क्या देना है, तैल स्निग्ध तैलमाश तराहाराम. तो उनको स्निग्ध तैल से बनाया हुआ स्निग्ध आहार और तैलमाश उद्दिन वड़ा, हम यहाँ पे इडली वड़ा खाते हैं ना, उद्दिन वड़ा, तो वो माश का वड़ा, वो इडली वड़ा खाने के लिए बोलना है। ठीक है। और हस्बैंड को हम क्या देते हैं उनको, मधुर औषधि संस्कृत घृत क्षीर और ऑल्सो माश का लड्डू, स्वीट लड्डू, घी में उसको भूनकर बेसन का लड्डू जैसे बनाते हैं, उसी तरह से माश का लड्डू बनाने का, और वो दूध के साथ खाने के लिए देना है। और सभी मधुर औषधि गण द्रव्य के औषधों को घृत क्षीर से मिक्स करके खाने के लिए बोलना है। सर्पिही स्निग्धम सर्पी क्षीराभ्याम, तो देखिए, मेल को सर्पी है, स्त्री को तैल बताया है। देन नेक्स्ट क्या बताया है, शाल्योदन भुक्त्वा, शाल्योदन, शाली इज राइस, खाना है, घी और चावल खाने के लिए बताना है मेल को। और दक्षिण पादेन पुम, तो जब भी वो कंसीव करने के लिए ट्राई करते हैं तो पुरुष को दक्षिण पाद, दैट इज राइट लेग से पहले आने के लिए बोलना है, और स्त्री को वाम पादेन, स्त्री तो उनको लेफ्ट लेग से आने के लिए बोलना है। फिर अगर पुत्र या पुत्री के लिए इवन एंड ऑड डेज बताया ना, तो स्नातनात् प्रभृति आफ्टर स्नान, दैट इज फोर्थ डे होने के बाद, अगर वो फीमेल या मेल को ट्राई करते हैं तो मेल को युग्म और इनको अयुग्म बताया है। ऑड डेज फॉर फीमेल्स एंड इवन डेज फॉर मेल, दैट इज फोर्थ, सिक्स्थ, एट्थ, टेंथ, ट्वेल्थ फॉर मेल, fifth, seventh, ninth, and 11th for female. On even days, it is said that there is artava alpata. ठीक है, which on conception produces male, and on odd days artava adhikata. That's why female child is born. Effect of Garbhadana done on Uttara days of the Rutukala. See, on the 12th day, there are all qualities. That is, the tell on the Rutukala of 12 days, the conception occurred on 12th day, Uttara. Up to the 12th day, what will happen? They will produce a child with good Ayu, Arogya, Saubhagya, Aishwarya, Baladihi. Then thereon, the qualities will start declining. That is, 9th, 11th, 10th, and 14th. See, 13th day, we should not ask them to uh, go for trying, because 13th, Acharya has told not to ask them for conceiving. Okay, and Amavasya and Purnima, we should not ask them for trying. Then comes the Pumsavana Vidhi. According to Dhalanatika, Pumsavana Vidhi is done with three objectives. That is, before conception for proper achievement of conception, immediately following conception for proper implantation, and before 3 months of gestation for change of the sex. But thing is, before conception, achievement of conception has become very important. एक तो पहले रुकता नहीं है, तो पुंसवन विधि के जो औषधि है उसके उनको लेकर हम कंसेप्शन के लिए ट्राई कर सकते हैं। एंड इंस्टिल 3 to 4 drops of गोक्षीर भावित विथ लक्ष्मण सहदेव एंड वटशृंग in right nostril for male and in left nostril for female. The labha with this is evam jata रूपवन्तः सत्त्ववन्तश्च आयुषः भवन्ति ऋणस्य मुक्तराः सत्पुत्राः पुत्रिणो हितः. That is, the baby which is born will be having all रूपवन्तः and सत्त्ववन्तः और आयुष्य, उसका आयुष्य भी अच्छा रहता है, आयु भी अच्छा रहता है और आयुष्य भी अच्छा रहता है। एंड ऋणस्य, सभी ऋणों को मुक्त करने वाला, जो ऋणी है ऋणों को मुक्त करता है, और सत्पुत्र, अच्छा पुत्र पैदा होता है। These are the benefits by following the Garbhadana Vidhi, or we tell the preconception care. In modern, any intervention provided to women of childbearing age, regardless of the pregnancy status or desire before pregnancy, to improve the health outcomes for women, newborns, and child. This is the same thing what we are trying to explain, which they understood after so many years, and they have defined to be there, saying that to improve the health outcomes for women, newborns, and children. Then, preconception care is set of intervention with the aim to identify and modify biomedical, behavioral, and social risks to the woman's health or pregnancy outcome through prevention and management. So, here prevention and management is the main understanding to not to cause any complications during the whole process of pregnancy and at the delivery and post delivery. Present condition we see is most of the adverse birth outcomes such as premature, preterm delivery, low birth weight, major birth defects, and in particular, maternal pregnancy complications have remained a persistent problem. We see so many problems that एक तो late marriage, late conception, lots of complications. So when we at least go for a preconception care, we can prevent these many complications which are there in day-to-day practice. Everybody is taking progesterone, ecosprin, या फिर वो सस्टेन प्रोजेस्टेरॉन के injections. So many things are always there because the body is not in a condition to produce that good hormones, nor it is that strengthful to hold the baby inside to grow it up to term. So to prevent that, we have to make the woman strong and always encourage the couple to have early pregnancy, not to keep postponing career करके postpone मत करिए. Try to have your pregnancy within 30 years of your age so that you have a good progeny. Then, to improve our national health status, we must change our approach ensuring healthy birth outcomes. First step is to incorporate preconception care into primary care as a routine practice. Routine practice karna hai. Primary care centers are the Anganwadis and all where we have to educate the women who come to us or the people who come on a regular basis to check and educate. Make what to say, हर महीने में एक बार एटलीस्ट एजुकेट करना है, हर किसी को घर घर जाके एक्सप्लेन करना है, या फिर एक प्रोग्राम करना है और कपल्स को बुलाना है जिनकी शादी हुई है रिसेंटली, उनको एक्सप्लेन करना है कि ऐसा है, आप ऐसे फॉलो करिए, गर्भाधान विधि तो फॉलो करना है, एटलीस्ट सिंपल सिंपल है, गर्भाधान विधि फॉलो करने से भी थोड़ा बहुत इफेक्ट आएगा. एटलीस्ट शोधन के लिए अगर पेशेंट नहीं आएगा तो भी एटलीस्ट फॉलो द sadvrutam, what is explained, or and the diet which is good for the pregnancy. Education and counseling regarding the smoking, alcohol, drug use, and pre-existing medical conditions such as hypertension, diabetes, and obesity. Obesity has become so much. All IT, MNC women come to us full fat. They want to reduce. They're not conceiving. Stress, we have to explain them how they have to change their lifestyle. Then early and appropriate evaluation and intervention can reduce the risks, results in healthier birth outcomes. So we have to at least ask them for proper lifestyle modifications. Then interventions involved. What are the interventions involved according to modern? That is reproductive life plan, reproductive history. We have to take current medication use, genetic history, if any, in the family, physical examinations to see if everything is intact, and substance use, that is drugs, alcohols, kya smoking, we have to check for. Screening, we have to do blood type, antibody status, vaccinations, what all they have taken, if any STDs, psychosocial health, how is their mental state, both of them, husband and wife. Then nutritional status, how was the food intake? Do they eat only junk or do they have good food? How is the diet? How nutritious they are eating? That has to be checked for. Then lifestyle intervention would be nutrition and exercise, psychosocial health, substance use cessation, and environmental health. See, nutrition and exercise is to asking them to have a proper lifestyle, have a good timely food. Main is timely food. People are not eating food on time and watching mobile or TV and having food. So curb it, not to do that. Have healthy food, that to have like fresh vegetables, और नॉट टू हैव द रेफ्रिजरेटेड फूड. हफ्ते भर का खाना फ्रिज में बना के गरम गरम करके खाना है, नो. एक्सप्लेन देम द आहार विधि एंड आहार टू बी टेकन इन अ प्रॉपर वे. देन एक्सरसाइज, रेगुलर व्यायाम करने के लिए बोलना है. सोशल हेल्थ, लाइक इफ दे आर स्ट्रेसफुल, then ask them to go for pranayama, do some meditation, mindfulness videos सुनिए. सोना है टाइम, अर्ली टू बेड अर्ली टू राइज, एक्सप्लेन, अभी छोटे बच्चे हैं वो, वी हैव टू एक्सप्लेन देम हाउ इम्पोर्टेंट इज स्लीप. देन इफ दे आर टेकिंग ड्रग्स, अल्कोहल, स्मोकिंग, आस्क देम टू सीज इट, एक्सप्लेन द कॉम्प्लिकेशंस. एनवायरमेंटल हेल्थ के बारे में उनको बताना है कि in which environment they are staying. If there is continuous fighting taking place in the house, somebody is screaming, somebody is fighting, how will the mental state be in peace? So we have to also environment where they are staying in and around. Mosquitoes है या फिर very bad smell is there, they're staying in some chemical industry area where too many chemicals are there, exposure to chemicals, radiations, mobile radiations. We have to explain all that comes under environment to prevent it. Then, if diabetes is there, proper medication and management has to be taken because birth defects are threefold high in diabetic women. We have to educate them to take insulin prior to trying for conception. Hypothyroidism, levothyroxine का level plan करना है. Priorly अगर है तो they have to go 3 months prior to the conception. They have to start with thyroid medications and then continuously keep it under observation. And they should also understand because of its neurological development is very important, and thyroid hormone requirement in women with hypothyroidism diagnosed before pregnancy has to be planned. एंडोक्राइनोलॉजिस्ट के पास जाना है और देना है. स्मोकिंग सीज करने के लिए बोलना है बिकॉज इट इज एसोसिएटेड विद प्रीटर्म बर्थ, लो बर्थ वेट बिकॉज ऑफ द ब्लड सर्कुलेशन विच विल बी हैम्पर्ड इफ शी कंटिन्यूस स्मोकिंग. और अगर वो अल्कोहल ले रही है तो फिटल अल्कोहल सिंड्रोम में बी सीन इफ दे डू नॉट एलिमिनेट अल्कोहल. एंड मैटरनल पीक्यू मैनेजमेंट हैज टू बी डन बिकॉज ऑफ द mental retardation may be there. Obesity is very important because if it is not in control, neural tubule defects, preterm delivery, diabetes, cesarean section सभी बढ़ जाएगा. हार्ट डिसीज रहेगा तो प्री एक्लेम्शिया, आईयूडी, oligohydramnios and mental retardation may take place. So both should be in control, diabetes and hypertension. अस्थमा रहेगा तो उनको कॉर्टिकोस्टेरॉइड का डोज अल्टर करने के लिए एंडोक्रिनोलॉजिस्ट के पास जाने के लिए वो बोलते हैं. लेकिन हम आयुर्वेदा में हमारा मेडिकेशंस बहुत अच्छा है तो हम देखे उनको प्रिवेंट कर सकते हैं. और लाइफस्टाइल मॉडिफिकेशन उनको बताना है. एनवायरमेंटल फैक्टर्स में एलर्जेंस जो है उनको दूर करने के लिए क्या कर सकते हैं जिससे अस्थमा अटैक आएगा तो लिमिट